Talk a little bit about those medications that people or have their kids on for ADHD and symptoms like that. What do those medications do if they continue the poor diet that they have? What does that do to the body?
Well, that's really a very good question, because the medical community believes, they really believe that they believe that ADHD is lack of that medication. So let's use Ritalin for an example. It's a stimulant. They don't even know why it works. They just know that it does just contrary to what it's supposed to do. It really slows the body down. Clonidine does just basically the same thing. I believe it was originally developed as a blood pressure medication. It can stunt growth. It could cause kids to have ferocious appetites. At the same time, it could cause kids not to eat. Statistically, kids who are on Ritalin and any of these medications will try and use drugs more than kids who are not. They have done statistical research on it. I believe the U.S. government will not even allow a child into the military if they're on any kind of those medications. They also have a greater potential to have chronic infections. Don't make wise choices when it comes to work. So then what happens to them, think about the emotional dependency on a medication. If you're 4 years old and you're taking a drug to slow you down a little bit, for the rest of your life, you're thoroughly convinced that it's almost like this whole entitlement mentality, that it's nothing wrong with me, it's all about what I need. It's all about what's going on, what medication do I need. So we teach wellness from the inside out. Your body heals from above down, inside out. You cannot put enough medication. I think what really hurts me more than anything is that they had a shortage of medications called Adderall recently. A shortage. 25 million prescriptions recently were written in the United States alone for ADHD kids. 5 million kids have ADHD. ADHD kids, it's going to sound kind of silly, become ADHD adults. ADHD adults usually have ADHD kids. And the reason is they eat from the same trough. So if mom is taking Paxil, Prozac, and Wellbutrin, child comes up, they're getting a, and I've also seen this happen. We have some teachers today that are impatient with their kids that have these challenges. But these kids, see, the game has changed. The way we teach kids is changed. So these kids oftentimes, if you have a kid that is really super intelligent and you're giving them the wrong oil, their brain is going to go into shutdown. You have got to feed them the exact right oil so their body's going to function at 100%. Those medications are going to cause dependence on more medications down the line from now.